Dinker. Last but not the least, definitely our last speaker will provide discussion about the experience of India. She is a social and environmental activist who speaks up for the rights of women and minorities, as well as against systemic deprivation and land grab backed by the powerful and, and the state. Her involvement in voluntary civic action against an ADB-assisted project in the coastal towns of her region grew into building a movement that thwarted plans of making it a giant petrochemical hub. She coordinates Growthwatch and is the national president of the Indian Social Action Forum, a platform of 720 member organizations and movements across 15 Indian states. She is also a core group member of the Karwan-e-Mohabbat that undertakes journeys of conscience, atonement, and love on the issue of communal hate crimes across India. Let us hear it from Vidya Dinker of Indian Social Action Forum Growthwatch.
Thank you, Carlo. Thank you. Um, my task is very easy. Everyone who's spoken before me has actually laid out the ground, and there isn't much to add. So I had said I'd try and finish in 3 minutes flat, maybe a little more. So I first would like to acknowledge that we have a triumph even during a pandemic. The farmer movement, which really surrounded Delhi and the capital and the seat of power was besieged by farmers demanding their rights. The rollback of 3 farm laws, they stuck it. They just stood there and sat there and petitioned and fought and struggled through the pandemic, and they all made it through. So all the fear about the pandemic seems a little unreal now that we have this big win where the government was forced to actually listen to agitating farmers that they were saying are a menace during the pandemic, and they cannot be, camping out there together and having so many protests together. But even as we celebrate sweet victory, we must not stop asking questions, because that's what the farmers told us. Do not stop asking those questions, whatever the circumstance. And therefore, in the light of the Asian Development Bank on the 25th of November, having approved another 1.5 billion loan to help the government of India purchase safe and effective vaccines against COVID-19. And the AIIB, of course, is very willing to co-finance an additional 500 million for the project. It's a time where our questions must be more pointed. And since they and our government do not seem to be really looking at the lessons learned and maybe any course correction, I guess it's incumbent upon us to do this questioning. The ground situation from India is that most of those who cannot come and push actively at the banks are deeply disappointed, they're helpless, and there's a lot of frustration because the questions put to the Indian government or to authorities around have been dealt very, very strongly with. So whether it's journalists, whether it's ordinary citizens, there have been cases filed against them, and most people have been asked to shut up. This is a time that billionaires have profited. Many Indian businessmen really made a lot of money, and while small businesses have crashed, street vendors, daily wage earners, and all kinds of people have really not made it through in terms of keeping their body and soul together during the pandemic. So we are a people really let down, not just by our government and the system, but also the NDBs who came in to purportedly help. We all know that the ADB has been very cozy with the Indian government, and the ADB and the World Bank really came in like knights in shining armor, very, very, I mean, very quickly. And they wanted to save us from poverty, starvation, ill health, or whatever. And and that meant that there was no control, perhaps, on the parameters, and that they must have put in place, or they should have put in place, for borrowed loans. And what we learned from our research and investigations is that the ball was dropped in the wave one itself. So the cracks were already in place, and they are now gaping holes. So and despite prior warnings from scientists, even as early as February 2020, the Indian government did not put in place enough actions. They delayed actions and did not prepare enough. But to go back to the program that we really looked at, which is the CARES program, so ADB leads, followed by AIIB, who then doesn't have to, of course, spend time and effort on doing any homework, on really processing closely, or on negotiations, and can just augment the budget and come in. But where did all the money go? The government will tell you every state got a package of funds from the central scheme under the COVID emergency response to really help with exigencies of the response to the COVID pandemic, for preparedness and to strengthen the health system. Let us see how it took care of its health workers. And the primary community worker in India is the ASHA worker. So an ASHA worker is a woman who will go out into the community, and a barefoot care worker who goes into the villages, the slums, the streets, and this scheme was supposed to cover even basic things like health insurance, etc., for 22 lakh workers in government hospitals and healthcare centers, including ASHA workers. So data regarding the amount allocated or spent for this scheme was not even available. The scheme of insurance for health workers covered loss of life during the pandemic and in case of accidental death on account of COVID-19. The government had no data on the number of COVID fatalities among the doctors and other hospital staff. And the Indian Medical Association did release a list of doctors who had succumbed to the virus. That was even as early as October 2nd, 2020, but the government continued to maintain that there was no central database to provide this information. So we looked at how many claims were made under this scheme, and that might be the insurance scheme. That might also be very low. And even those who had applied for insurance, for example, we got the case of 77 health workers who were rejected since they do not meet the criteria of being primary care workers. ASHA workers, the women workers that we are still in touch with, very clearly, it's a very sadly and extremely neglected lot. They have been agitating and they have been begging, and yet they do not get the really basic support from the government to undertake this huge kind of drive of outreach in healthcare for the community. So did the CARES program really care for our care workers? We found not. To follow the money trail, we filed RTIs with the Department of Economic Affairs in the Ministry of Finance and various line ministries. That's the Ministry of Health and Family Welfare, the Ministry of Rural Development, the Department of Agriculture, Cooperation, Farmers Welfare, Ministry of Consumer Affairs, Food and Public Distribution, because as we all know, that was a big challenge during the lockdowns in India. Very limited information was forthcoming as to how the CARES money was actually utilized by the executing stakeholder departments, which made us conclude that there was a complete lack of transparency with citizens or even other government departments. So there was no clear utilization data of the loan amounts, either from the Ministry of Finance or from the executing agencies. There was very poor monitoring and implementation. Reports we accessed through government reports or the right to information were of very poor quality. And just a compilation really of press information bureau bulletins and media articles that really any citizen could have put together. And so monitoring reports in public domain have been really, really bad. What about the whole aspect of green recovery, right? So the pandemic was a place, sorry, have I missed any messages? No. Okay. When you talk of green recovery, you think this is the chance, right, to build back better, etc. What we found in India is that this is the time when those who wanted to mess around with the environment really made hay. So public notices for tree felling that we are still grappling with in even a city like Bangalore, tree felling for the metro project was all brought out during COVID restrictions and lockdown. So people couldn't go on board to go on site to check them out. These are also for projects that are funded by banks. The other thing that was very curious is that public hearings for really large infrastructure projects, for mining projects, for industrial projects, all these kinds of green clearances were being considered through video conference meetings. So suddenly no public hearing on site, people could not go, project affected people couldn't go and participate in deliberations, face-to-face interactions, could not put their points forth. And expert committees were giving such projects, even hydro projects in pristine forests, railway lines and highway projects through forested areas were getting their okays. Not to mention, really no-go areas or mining. For example, 4041 mining blocks were opened up to commercial interests. And so I think we have a long way. We know what India did at the COP, and what it did through the pandemic really laid the foundation for coal to continue to flourish in India, as also oil and gas. Carlo is telling me to wrap up. We're thinking that because there's been a lack of monitoring, mid-course assessments, or even the adoption of adaptive management measures, what these loans have done is provided the Indian government the license and the luxury of a continued lockdown, which really was very hard for ordinary people. It experimented on its people because it was fat on funding from the NDBs. It pushed its people into a digital economy. A lot of, Amazon and all these kinds of companies have had many more people logging and getting things home in package form. Local stores are closing down. And of course, the opening up, as I said, of no-go areas for exploitation, which is, India doesn't yet have a pandemic preparedness plan in place. There's no adequate medical infrastructure that has been created, while it had ample time between the first two waves, and whatever was created has already sort of collapsed even before the third wave that we might have coming up to us. So there's a lot to fix. lots of questions, and I hope that we can hold both our governments and the multilateral development banks accountable.